In today's video, we'll discuss about syncope. What is syncope and how it is different from fainting? So, first of all, the definition, it is the generalized weakness of muscles, loss of postural tone, inability to maintain an erect posture, and loss of consciousness is defined as syncope consciousness. Whereas in fainting, what you see is there is first of all the loss of consciousness and lack of strength. All right, so syncope and fainting is both a different concept. Now coming on to the causes. In causes, first of all, it occurs due to the decreased cerebral perfusion. Then it can also occur due to certain non-circulatory causes. Okay. Now coming on to the decreased cerebral perforation. First of all, when there is vasoconstriction. So we will write then when there is an inadequate vasoconstriction mechanism. Now this is usually seen in vasovagal, postural hypotension, then carotid sinus syndrome and antihypertensive drugs. Then is when there is decrease in the vascular resistance. Now this occurs during cough, micturition, mediastinal compression, also when straining at stool evacuation. Then comes the cerebrovascular disturbance. In this we have hypertension, then we have transitory ischemia, ventrobacillar insufficiency. Then after this we have hypovolemia as one cause. In hypovolemia, basically when there is hemorrhage or there is Addison's disease. All right, then we will also mention about the arrhythmia. Arrhythmia can be seen in cardiac tamponade, pericarditis, ventricular assystole, AV block. Then one is left, which is reduced cardiac output. So aortic stenosis, then MI, then cardiac tamponade, also in pulmonary embolism. Now in non-circulatory causes, what you can remember is first of all is hypoxia, then hypoglycemia, then hyperventilation, then remember anemia, anxiety disorders. Also there is one more, which is prolonged bed rest. Now prolonged bed rest can also lead to a lot of other factors which we will discuss later. So coming on to the types. Now in types, what you need to know is a general idea of every type. So coming on to the vasovagal type. In vasovagal type, what it is usually it occurs in normal individuals as well. It is recurrent because of the emotional stress. Then there is mild blood loss or prolonged bed rest. They act as precipitating factors to the vasovagal. Now it involves both. First is the cardiac slowing as well as the reduction in the systemic peripheral resistance. All right, so it is basically we elevate the legs of the patient and we remove the offending agent. All right, and we assume a supine position of the patient. Then coming on to the second type, which is the postural hypotension. In postural hypotension, basically it will occur when there is basically there is one state only, that is the person is recumbent to some illness, or he or she is having peripheral neuropathy, that is they're not able to move from one place to another. There is micturition syncope. Now this usually occurs because of the release of the intravesical pressure. Now this pressure leads to vasodilation, sudden vasodilation. Then is the cardiac syncope. Now cardiac syncope will lead to decrease in the there is a decrease in the cardiac output. So there is an abnormal decrease in the heart rate, so heart disease. Then carotid sinus syncope. Now over here, you need to remember that this is basically causing the decrease in the blood pressure, because they are centers for blood pressure, carotid sinuses. So this and cough syncope is when the patient is suffering from COPD or bronchitis. Then cerebrovascular disease may there is narrowing of the large vessels. All right. Now coming on to the investigation. For investigation, what we do is we do the measurement of the serum electrolyte. Then EEG also forms as a very important investigation. Then Holter monitoring. Then blood and urine toxological study. Then we will also do the upright tilt table testing. Then electrophysiological cardiac testing. Now, basically, to find the cause, we will do MRI and Doppler. Now, in management, what you need to do is, first of all, the aim is to not cause any of the injury. So, in early phase, the person must be placed in a position where there is maximum blood flow to the head, that is the brain. So, so what we do is we lower the head between the knees while sitting, and all the clothes are loosened, and we avoid the fall of tongue because it can lead to airway obstruction. We'll observe the patient. Then in prevention, what you can do is, suppose if you already know that the person suffers from postural hypotension, so what we do is we tell the patient to exercise the feet before getting up, also before causing any movement. Then in vasovagal syncope, this basically happens because of the increased excitement or basically due to anxiety, so it must be avoided. Then in hypotension also, we can also give a drug if it is chronic, that is fludrocortisone 0.1 to 0.2 milligrams per day. Now in carotid sinus syncope, there is a decrease in the blood pressure, so what we do is we loosen the cervical collar, and atropine and ephedrine have should not be given. Now in certain cases, like cerebrovascular diseases, this is quite severe, so what we do is we retreat to the surgical approach. So this completes the syncope part of CNS.